Hello, we're reporting from ACC 25 here in Chicago, and I have the honor of interviewing Dr. Shitian Li, who is faculty of Fuwai Hospital, National Center for Cardiovascular Diseases, China, Peking Union Medical College. Thank you, Dr. Li, for being with us today.
Thank you for having me.
Thank you. And we're just so excited to learn about your trial, which is entitled Homogeneous Effects of Intensive Blood Pressure Control in Patients with Various Frailty Status, a Post-hoc Analysis of the ESPRIT trial. Dr. Li, would you tell us a bit about your trial?
Okay, so as you mentioned, this was a post-hoc analysis of the ESPRIT trial, and the main results of the ESPRIT trial have been published in the Lancet last year. And in the ESPRIT trial, we randomized more than 11,000 participants, hypertensive participants with high cardiovascular risk, either to the intensive treatment group with an assigned SBP target less than 120 millimeters mercury, or to the standard treatment group with an assigned SBP target less than 140 millimeters mercury, and they were followed up for 3.4 years. The main findings of the ESPRIT trial suggested that targeting SBP less than 120 millimeters mercury prevents major vascular events, although with minor excess risk compared with the targeting SBP less than 140 millimeters mercury. And so the reason why we conducted this post-hoc analysis is that, as you may know, burgeoning geriatric population and concomitant epidemic of frailty impose heavy burdens on healthcare system worldwide. And treating frail hypertensive patients is really a growing quandary in clinical decision due to their vulnerability to polypharmacy. And the risk-benefit profile of intensive BP control remains uncertain, particularly for those with moderate to severe frailty. And most guidelines did not give a numerical target for the frail older adults. So in this analysis, we constructed the frailty index according to the Rockwood cumulative deficit approach, which was one of the most commonly used approaches to characterize patient severity of frailty. And more than 30 items were used to construct the frailty index in our analysis, and majority of them were used in the Harvard Sprint and the Advanced trial. So in total, more than 5,000 participants were categorized into the moderate frailty group, and more than 3,000 participants were categorized into the severe frail group. And the event rate of major adverse cardiovascular events in the severe frail group is much higher than the other two.
Thank you for giving us that summary of your study, Dr. Li. Our next question is, could you tell us the key points, the key takeaways of your study?
Okay, so in terms of the relative effect of intensive BP control, those with severe frailty got just the same benefit as those with moderate frailty and those without frailty, and there was no statistically significant interaction between frailty status and the effects on composite kidney outcome. And the absolute risk reduction did not differ substantially across frailty status.
Those are very interesting findings. And our last question to you, Dr. Li, is what is the clinical application of your study findings in today's practice?
So our findings suggested that treating 1,000 hypertensive patients in the severe frail group for 3.4 years will prevent 30 MACE, 21 all-cause mortality, 16 composite kidney outcome, and 7 injury falls. So do be careful in the practice. But generally speaking, the participants with severe frailty benefit as those without frailty or moderate frailty. So our analysis support adopting the intensive BP control strategy regardless of participants' frailty status.
Again, thank you for being with us, Dr. Lee, and I want to congratulate yourself, Dr. Liu, Dr. Zhang, and Dr. Lee from your academic institution for completing this study and presenting your findings today at ACC 25. And for more videos like this, please check out our channel at youtube.com/FITsOnTheGo. Thank you.
Thank you. My pleasure.